Thanks for joining us again and welcome back to Explorer today. I want to appreciate you for watching. Hopefully you had a good weekend. I hope you've been watching our videos and as we continue to produce informative content with regards to the African continent.
But our healthcare system is so broken that we need a lot of resources and we need a lot of transparency and accountability to make use of even the little that we want to put in it.
I was just thinking of making this video, but I actually did a video about this. The rate at which African doctors are leaving the continent, it's mind-blowing. The rate at which they are migrating to other countries, it's mind-blowing.
These are familiar scenes at job recruitment exercises in Nigeria. There is a special difference in this particular instance though, as these are qualified medical doctors applying for jobs overseas, in Saudi Arabia to be precise. What you can see behind me right now is the process of the recruitment of Nigerian doctors by the Saudi Arabian authorities. This exercise is currently ongoing at the Sheraton Hotel and Towers right here in the Nigerian capital, Abuja. Nigerian resident doctors have been on strike for almost a month in their demand for better working conditions, and negotiations with the government have failed repeatedly. And the prospect of working for the Saudi government is now seen as a big escape.
The federal government is showing the cold shoulder attitude, doesn't show any kind of responsibility or being careful about the situation. I can't imagine,
I've thought for a while to make this video. I once produced a particular video talking about why African doctors are leaving. You can check it here. On today's episode, we are looking on how Africa loses and how the Western countries benefits from medical brain drain that ravaged the African continent. On today's episode as well, we will lay down to you the reason why Africa's medical insufficiency has also affected the continent, and more importantly, why the better environment for African medical experts. We will also explain to you why this strategy has affected the continent in a number of ways that needs to be looked at before things get worse. So without any much delay, we shall just dive straight into it. Africa bears over 24% of global disease burden, with only 3% of health workers to take care of the sick. Though this has been a perennial issue, the recent COVID-19 pandemic has further exposed the healthcare shortfalls in the continent. The lack of access to testing, shortage of lack of ventilators and also medical equipment hampered efforts to save lives at the peak of the outbreak. The exact number of African healthcare workers infected with COVID-19 since the start of this pandemic was hard to be calculated. However, as of July 2020, based on figures that exist, the World Health Organization reported that the number of more than over 10,000, which compounded to challenges and also shortages of medical staffs on the front line. A major driver of these shortages of healthcare professionals has been the increased medical brain drain as Africa's health professionals migrate in droves to developed countries like the United States, the United Kingdom, and Canada. The question here many are asking is, what is responsible for this and also the reason why this transformation in terms of migration moving into those developing countries? That is the reason why we shall be looking at today. If you are new to our channel, we will encourage you to subscribe and share our videos to your different network. But I've tried to hold myself with regards to making a video that is more informative in a way, but I thought it's wise. Now, seeing videos like this,
I left because I got frustrated. I worked in a place where I worked in an environment where for the first 4 months of my employment, I was owed. And in these 4 months, I had bills to pay, I had responsibilities to meet up to, I had to be at work every day.
My Honorable Minister of Health came out and he threatened us. So I think it does not make sense, or it doesn't make much. I mean, it wasn't the situation. To be candid, we're very, very disappointed. I personally am disappointed. When I go to where I work, I work in a very critical care services of the hospital. But basic things that we need, we don't have. Some things I used to put in my money to buy what I need, just for the sake of the patient. And to worsen the situation and to make the matter worse, and day by day, there is no any progress.
Such videos tells me that something is wrong in the medical field. Now, the medical brain drain we've been talking about on this channel has been something that has plagued the African continent for a while now. And there is no way that this is going to stop. Because I was watching the news the other day and I saw a video coming out from Nigeria. Just check it out.
The brain drain by Nigerian doctors to the proverbial greener pastures has for long been a known fact, but having a foreign government conduct massive recruitment of Nigerian doctors in Nigeria is taking the issue to a whole new level, and there is no telling the likely far-reaching effects of this down the line.
Something is wrong, something needs to be done. And these doctors are moving and leaving their country. They are going to work somewhere else. And there's a lot of questions what's happening within the continent with regards to the medical things. We've made a video here talking about the relevance with regards to tackling the medical section, which is an area where the continent needs to invest and put in money into it. And I feel like this particular message is not sinking well. Africans spend a very minute or insignificant amount of the GDP in health care. But this is the area where the continent needs it most than any other sector. As recommended by the World Health Organization, the ideal doctor to population ratio is about 1 per 1,000 persons. But the reality is that Africa has a low ratio of its doctor, just over 5,000 patients. By 2035, the deficit is expected to be reaching about 4.3 million physicians. The United Kingdom, for example, with a population of just over 68 million people, has more than 370,000 physicians, while Nigeria, with over 211 million people, has less than 75,000 physicians, according to World Health Organization data. Many of the doctors working in the United Kingdom are from Nigeria, and the number of Nigerian doctors has been increasing, for example. More importantly, for instance, as of 2006, there are over 2,690 Nigerian doctors in the United Kingdom medical facilities or workforce, and by over 2018, looking at those figures behind, the figures looking at rising to over 5,000. By that end of a considered number, the UK was employing at least 12 Nigerian medical doctors every week, according to report. If you look at this transformation, as of 2016, the former president of Nigeria Medical Association said and estimated that over 8,000 Nigerian doctors were practicing in the United States. And looking at same figures in 2015, study has revealed that over 86% of African Education International medical graduates, looking at that in the United States, and also parts from physicians moved to different parts, also coming from countries like Egypt, Nigeria, South Africa, Ghana, who moved and never returned. Apart from the physicians, other U.S. healthcare occupational groups are also made up of high percentage of Africans. For instance, 24% of these registered nurses, over 20% of the nurses' assistants, 16% of also personal care aides, aides to the point out, are from the African continent. Canada also has a history of growing its medical workforce with African-trained doctors. As of 2019, the total number of foreign-trained doctors in Canada was over 22%, including those from Africa. Other countries include Australia, Saudi Arabia, and also the United Arab Emirates have also sustained their relatively high physicians to the population ratio by employing medical graduates from the African continent. If you are new to our channel, we will encourage you to subscribe and share our videos to your different network. Now, I'm really surprised when I see doctors leaving and watching videos like this. Again,
I left medical school April 2011. My teacher is here. my own teacher, the first person I cited here, was my teacher, a seasoned pediatric consultant. You know what it means? My teacher that taught me how many years ago, I'm giving up on the country, on our leaders, and I come here to meet my teacher. I mean, this is the worst. I never knew it has gone this bad.
I believe something has to be done with regards to this. This is not only happening in Nigeria, it's happening across the continent, from Uganda, Ghana, Ethiopia, all over sub-Saharan Africa entirely. And these doctors are leaving. They are living for, of course, you cannot question to a certain extent, but their living condition needs to be improved. Some of them question the salary they are making. The other day, I actually ranted with regards to this particular problem while I was just chilling. And I was saying things like this. I'm talking about this other section where the people are actually living, not against their will, actually. They're being pushed out as a result of the system. I saw a long application line where, especially in Nigeria, medical doctors are applying to travel to Saudi Arabia and other Middle Eastern countries. Now, I find this very interesting in a sad way, you know, because I've said in this channel that Africa needs to sit up. Africa needs to take its own responsibility. Now, how can a medical system failing for so many years? The most important thing that the continent has to invest billions and billions of dollars in it should be the health care and facilities that are needed. But nothing. Those professionals, I hear people cry and say that, oh, there are lots of Nigerian doctors or Africans working in the United States, working in the UK, working across Europe and in Asia, and you are still surprised that this is going to continue. It will continue, and as I'm speaking with you, there are medical doctors who are preparing to leave the continent. Yes! They're leaving, and they're going to leave. First of all, these medical doctors are in a poor shape in terms of salary, in terms of motivation, in terms of a structured system. Now, the healthcare system is so rigged that these medical professionals are finding it so difficult to sit up. Now, I understand some of them also are like blowing things out of proportion, but no, it's not true. They are actually in difficult situation. Now, I wonder why this has been for years and nobody is talking about it. Nobody is doing anything about it. If you go to the United Kingdom, in the UK, just move around, you will see a lot of medical experts running the UK medical system are people from the African continent. Yes! And don't tell me you cannot offer the same system in the continent. Don't tell me it's so difficult to build a world-class hospital in the system. Now, when it comes to a point where a man or a woman want to make decision for the good of their own family and for their own self and their own careers, then you crying foul that they are going to the UK, they are going to America, they are going to leave there. Yes, they have to go. I mean, yes, they have to go, and there's nothing you're going to do about it. There is nothing you're going to do about it because these people have to go. Now, let's talk about how many years medical doctors will spend in school. Some will be there for 7 years, 10 years, 12 years, whatever field that they are going into. And you expect, after investing that huge amount of money, you come now and tell me that I'm going to sit up and be looking at you. It's like somebody goes and spend $20,000 or $25,000 or $30,000 for an MBA, and you expect them to fold their arms and look at the system. No, they have to make decisions to move. These doctors have to look for a place to eat. They have to take care of their families. You can't just tell them to sit in one place. I hear this thing of like, oh, these African doctors or African experts travel abroad and study there and don't go back to the continent. And you say you should come back. They don't just move like that. And you know it. You can't just relocate just because you hear people saying that. And these doctors have to go to these countries. And I assure you, most of them who are senior medical experts, they are going into this country. They will not fit into those top roles that they were in their own countries. But who do you blame? They have to put food on the table. This is just the fact. Look, listen, we have to start speaking the truth, what is happening. These medical doctors are in bad shape. They are in terrible condition that they themselves cannot succeed. We just really don't have an argument with regards to solving this problem. And it's funny that nobody's talking about it. Yes. And if Africa needs to be competitive or must be competitive, managed or invest hugely into the healthcare sector. Because all of these problems we are talking about, I was basically ranting about this. This problem is so huge that you don't find it anywhere in the news. And the doctors are filling applications to go to Saudi Arabia. And most of these doctors are going there to become like basic nurses. Yes, they have to move. And what are you going to do? This is a major problem that needs to be looked at. The fact that we are talking about there are lots of improvement and development in other sectors. The healthcare sector has been abandoned. Do you agree that African doctors should be leaving? Do you agree something to be done? Drop us a note or leave us a comment in the comments section concerning why African doctors are leaving to Canada, Western countries, to Australia, to the United Kingdom, and across Europe. This is going on at the moment. Something has to be done. And we've played our part. At Explorer, we believe that this is one of the biggest problem that the continent is facing and needs to be looked at. Let us know what you think, if this is something that the continent needs to work on. I want to thank you for watching. We encourage you to watch our other videos, and we are looking forward to meeting you in our next episode. Have a good day. Bye-bye. The fact that we do have a responsibility here are talking about. Thanks for joining us again and welcome back to another informative and educating content in the continent of Africa. We want to thank you for watching our videos.